Hello everyone, this is Trisha Trink. I'm the physical therapist from Tryon Estates Rehab Team. I'm so excited to present this important information on bladder control to you today. This is one of my main areas of specialization and one that I'm very passionate about. So let's get started. So when it comes to bladder control, don't make me laugh. The truth and the taboo of treatment of urinary incontinence and pelvic health. With age comes skills. It's called multitasking. Yes, I can laugh, sneeze, cough, and pee all at the same time. Not really a laugh matter. Is this you? Because of incontinence, are you limiting your social activities, not going out as much because you're too embarrassed? Missing and avoiding important appointments, whether they be with family, friends, avoiding travel or visiting family, getting up multiple times of the night and not getting a good night's sleep, afraid or too embarrassed to talk about your incontinence with your doctor, feeling that there's nothing you can do to address the continence concerns, changing your drinking and eating habits for fear of needing to go to the bathroom at inopportune times. Let physical pelvic therapy help you. So the objectives of this particular in-service are: 1, to have a basic understanding of the anatomy and physiology of the urinary system; 2, understanding a basic overview of normal bladder function; 3, appreciate the impact of urinary incontinence on quality of life and cost; 4, understand the general causes of urinary incontinence; 5, learn about the different types of urinary incontinence and the elements of good bladder control; 6, appreciate the role of bladder irritants and urinary urgency and frequency; and last, explore options for intervention and seeking assistance to address continence concerns. So with the anatomy of the urinary system, some of the anatomy and physiology, where we're going to start with is the kidneys up at the top, and they produce urine, which is transported through the ureters, which are the long tubes that you see coming down, to the bladder, which is like a big balloon vessel. The bladder is a muscular sac that functions to store urine and then pass the urine from the bladder to the urethra and then outside of the body. Now we're going to be talking about the physiology of the urinary system. This diagram shows the process by which bladder filling and bladder emptying occur. At the top of the diagram, we have normal bladder filling. The bladder fills from the bottom up. To prevent urine loss, as the bladder fills, the sphincters stay tightly closed and the pelvic floor muscles stay contracted. Moving along the diagram to the right, we notice the first sensation to void. This does not necessarily indicate that it's time to go to the bathroom, but that the sensors in the bladder are aware that urine is filling the bladder. On average, adults can wait up to 30 minutes or so before this first urge before going to the bathroom. When the bladder is mostly full, a message is sent to the brain to indicate that it's time to void. Micturition, or bladder emptying. When the bladder has filled to a specific volume, receptors or nerves in the bladder sense this fullness. Bladder emptying is accomplished by relaxation of the pelvic floor muscles, as well as relaxation of the urethral sphincters. Bladder contraction, which forces the urine out of the bladder and subsequently out of the urethra, then occurs. Next, these images are showing a cross-sectional view of the female and male pelvic organ region. The pelvic floor muscles are at the base of your pelvic floor, hence why we call it the floor, and form a hammock to support the organs in the pelvis. Both men and women have these pelvic floor muscles. When they're relaxed, you're able to urinate. When they are engaged or contracted, they stop the flow, or they keep everything up and in nice and tightly. When these are critical muscles to keep the lower urethral sphincters closed until it's time to void. If your pelvic floor muscles are weak, you may experience incontinence. The anatomy for men and women is relatively similar for both men and women, and when it comes to start when it comes to issues related to incontinence, the issues are very similar. Okay, and as you can see, the pelvic floor muscles are where the arrows are pointing at the very bottom of the area where the rectum is on each of the male and female diagrams here, and then they're on the other side as well too. So underneath of where the bladder and the prostate for the male and the uterus for the female. So they line the entire pelvic floor area. So they're very important when it comes to our ability to control our bladder. This is a diagram of looking from the pelvis from the bottom up, and the white areas that you see are our bony areas of the pelvis, and then the red are the different areas of the pelvic floor muscles. So without the muscles being there, we have a large hole in the bottom of our pelvis, and this entire hole is filled in with pelvic floor muscles. And you can see that they go in different directions, indicating that they have a slightly different function in the pelvic floor. So they're very important for us to keep strong and healthy. And they're very important, play a very important role in both bowel and bladder control, as well as supporting the organs and as well as our posture and intimacy. There are 3 layers and must respond to changes in intra-abdominal pressure, movement, and bladder and bowel fullness. So again, extremely important muscles that we need to learn to have good control over, and we'll be going into this a little bit more detail. So good bladder control is all about teamwork and coordination among the following. The bladder holds the urine or contracts and then contracts and lets the urine out. Muscles and sphincters must coordinate to open and close the urethra, and nerves send messages to and from the brain telling the bladder muscles to contract and the sphincters and the muscles to open if they need to urinate or if we need to hold urine. Our nerves tell the bladder not to squeeze, but the sphincter and the pelvic muscles stay toned to prevent urine from flowing. Any of these areas that has a problem can contribute to or cause incontinence. So again, it's important that they all work together and that they're all strong and healthy. Let's look at normal bladder function. The average bladder function is as follows. The average adult bladder capacity is approximately 1 pint. For the older population, it's approximately 1 1/3 cups. The average number of voids per day is 4 to 8 times in 24 hours. For the older population, it's 5 to 10 times in 24 hours. Average nighttime voids, under the age of 65, seldom or 1 time. Older than 65, 1 to 2 times. Urgency should be rare. A healthy adult should be able to hold the urge to go to the bathroom for up to 30 minutes. Urgency can be the result of bad habits over the years, like holding urine for too long before emptying the bladder. Often this gets established when we're working certain jobs that make it difficult for us to rush to the bathroom, such as teaching or working at a job where we have to stand for long periods of time. Over time, we suspect that the signal to the brain and the overstretching of the bladder from the disregard of the need to go changes the ability of the bladder to hold urine so that the urgency signals are sent too late. So the facts. Approximately 13 million people, 1 or 3 older adults in the US, suffer from urinary incontinence. The annual cost is more than $26 billion a year. Most people do not seek help due to embarrassment or unawareness of treatment options. And the outcomes from treatment are better when symptoms are lighter or less severe. And just so you know, these numbers are likely higher, but many people don't report the problems due to their medical professionals. So once again, due to embarrassment or not being sure how they're going to be received. So possible contributors to urinary incontinence with women include things like multiple pregnancies and childbirth, hormonal changes of menopause due to weakened pelvic floor muscles, bladder prolapse, urethral dysfunction. With men, it's often related to enlarged prostate, putting pressure on the bladder, and post-prostate surgery. Other contributing factors can include pelvic trauma or hysterectomy, recurrent urinary tract infections, spinal cord damage or lumbosacral nerve issues, drinking too much caffeine, and adding in other bladder irritants that we'll be talking about. Certain medications can also have an impact on our ability to control our bladder, such as diuretics, sedatives, beta blockers, cold and allergy remedies, pain relievers, and then our decreased mobility or ease to get to the toilet. Urinary incontinence is not a normal part of aging. Some examples of how aging may contribute to the prevalence of urinary incontinence include decreased activity, orthopedic conditions that affect mobility, such as osteoarthritis, decreased strength and endurance. And we have noticed an increased problem with the recent COVID restrictions, where people are not getting out of their apartments as much as they used to. We're sitting more than we used to, and therefore we're not getting the strengthening that goes along with the day-to-day activities, including of our pelvic floor muscles. However, something can be done. Common does not mean normal. Although the prevalence of incontinence does increase due to other factors associated with aging, it does not necessarily mean that it's normal. We can do something about it. It's never, ever too late. Losing control. There are 4 types of urinary incontinence. One being stress incontinence. Stress incontinence usually happens when we experience leakage with laughing, sneezing, and coughing, or during certain physical activities where the intra-abdominal pressure is increased. And we have pelvic floor muscles that are weak and aren't able to control the urinary loss. In men, it can occur after prostate surgery due to loss of urinary sphincter or damage control, or nerve damage, Okay, so I want you to try something. Try coughing right now while your hands are on your stomach. Do you feel the additional pressure caused by the abdominal area in the abdomen? That added pressure pushes the bladder down and into your pelvic floor. If your pelvic floor muscles are weak, there can be leakage that occurs as a result. The next type of incontinence is called urge incontinence. Do you experience a sudden urge to go to the bathroom when you put your key in the front door, you hear running water, you drink a small amount of fluid? Do you have trouble making it to the bathroom in time when you have any of these kind of urges that come, where you feel like you've got to go, I've got to go, I've got to go? We've all seen those commercials. This type of incontinence is urine loss when an urgent need to go to the bathroom hits, and this is caused by involuntary bladder contractions. Our next type of incontinence is called overflow incontinence. When the amount of urine that is produced is more than the bladder can hold, or the bladder never completely empties and a constant dribble occurs. We do tend to see this more and more. So there's another type of, the last type of incontinence that we're going to discuss is called functional incontinence. So urinary leakage due to the inability to get to the toilet or use the toilet because of post-surgical limitations, impaired physical functioning, and environmental barriers. So think about being unable to walk very quickly to or from the bathroom right after surgery, or you've got a cluttered or obstructed pathway and you have limited mobility following different injuries or illnesses. So the combination of stress, urge, and mixed account for more than 90% of the incontinence cases. So you can see these examples up here that give you an idea of where we can actually have a combination of some of these issues as well. So possible bladder irritants. There's quite a long list of these. So a common issue impacting urgency and frequency is the consumption of bladder irritants. So this is going to show us a list of some of the possible irritants that we might want to keep in mind. Try keeping a log of the food and fluid that you intake over a few days and notice if any of these items impact you? If so, try decreasing or eliminating them and seeing the result. The most common ones are underlined here, and you will receive a handout with these different irritants, so you don't have to memorize them. So the first on the list is alcoholic beverages. Next we have apples, citrus, and fruit juices, cantaloupe, carbonated drinks, highly spicy food, chocolate because it contains caffeine, caffeinated beverages such as coffee and tea, tomatoes or tomato products because it's acidic, corn syrup and artificial sweeteners, vitamin B and C. And that's not to say that you shouldn't take vitamin B and C. There are vitamin B and C that are out there that are non-acidic. So look for non-acidic vitamin B and C. Cranberries, and I know a lot of people say cranberries. I thought I was supposed to drink cranberry juice when I have a urinary tract infection. And again, we have to look at, there's different aspects of the cranberry that are irritating. And also most cranberry juices have a lot of sugar, and that can be a problem too. So again, you can talk to your physical therapist or your doctor about whether or not this is a good or a bad thing for you. Grapes, peaches, pineapple, plums, and strawberries. And again, this isn't to say that everyone's going to have the same irritation from this entire list. It could be that some people have an issue with strawberries and a combination of sort of other things. So this is where keeping that bladder log will be very helpful. And again, it will be also good to talk with your therapist and your medical team about what might be the best way to go about eliminating these different products. Let's look at the most common bladder irritants. We've got some strategies here listed that help us to manage these actual irritants. So if we look at coffee, a substitute for that would be decaf coffee, low acid instant coffee such as kava. So what we're looking at here is that anything that is acidic tends to cause an irritation in the bladder. So then we're looking at acidic fruits, and substitutes for those can be pears, apricots, papaya, watermelon, and blueberries. Blueberries are an excellent substitute because they're extremely high in antioxidants. Tea is another bladder irritant because of its acidity, and we can substitute decaf tea and herbal teas. There are many great herbal teas on the market that help to relieve stress and tension in the pelvic floor muscles as well. Another major irritant is carbonated soda and alcohol. So try instead water, good old H2O. That's the best thing that we can do to stay hydrated, both for our bladder and our bowels. So if you drink caffeinated drinks, alcohol or soda, follow with a full glass of water to dilute the effects on your bladder. So have you ever reduced the amount of fluid that you drink, especially water, because of concern about going to the bathroom? A lot of people stop drinking water about 6 o'clock in the afternoon or evening and thinking that it's going to be helping their bladder. The problem is we want to drink water. It is the absolute best beverage to drink. Drinking adequate water daily also helps with decreasing the issues of constipation, which can cause increased pressure on the pelvic floor from bearing down during toileting activities. And many people with bladder problems reduce the amount of liquid thinking that they are hoping to urinate less. However, reducing your fluid intake causes more concentrated urine. This can be irritating to the bladder lining, which increases symptoms. It is recommended that we drink 6 to 8 ounce glasses of water a day. So I want you to also start thinking about paying attention to the color of your urine. The darker the urine, the less water intake that you're getting, which is going to make you more prone to bladder issues. So what can you do? If you deal with urinary incontinence, these next few slides offer some actions that you can take right away. Here are some initial considerations. Monitor your urinary patterns. Keep a log of how many times you void, how long you void, how many accidents you have. So when you see a therapist, you can share this information and that we can help you find different strategies to address these issues. So each void should take 5 to 10 seconds. If less than this, you may be going too frequently or training your bladder to do so. Schedule going to the bathroom every 2 hours, whether you feel it or not. Drinking enough water. We discussed that earlier. Learning breathing and relaxation techniques, as these can help you to void more fully. Check with your rehab and fitness staff about Tai Chi and yoga and the need for possible therapy. Stay active. Ask your rehab team about a Thrive exercise prescription for this particular issue. Let's practice good lifestyle habits. The first being getting adequate sleep. A decrease in sleep can irritate the bladder and lead to earlier sensations of needing to void. Deep sleep allows the bladder to rest so that you don't feel like you have to go frequently. I'm going to give you a little tip here. If you get the urge to go in the middle of the night and you're feeling like, I just don't want to get up, I'm in too good of a sleep, pump your ankles up and down 10 times. This sends a message to the brain that I don't necessarily have to go right now. It can help you fall back to sleep. Watch what you eat and drink. As we mentioned before, there are certain foods and drinks that can irritate our bladder. And remember, H2O is always our best substitute. Physical activity. Increasing our physical activity with general strengthening encourages regular bowel control movement and overall bladder wellness. Also, getting involved in recreational activity and social activities. This keeps us engaged and motivated to stay dry and to seek help to improve. Continence strategies. We know that this is a little limiting right now, but there are ways that we can stay active, especially if we go to Channel 900 and watch Caroline and Steve with some of the great activities that they've been providing for us. So what else can you do? Make an appointment with your urologist, urogynecologist, nurse practitioner, or primary care physicians to discuss your concerns. They will evaluate you and take the appropriate testing that is needed. Ask your primary care physician for a prescription for physical or occupational therapy. Access therapists who specialize in pelvic health treatment. And we have 2 right here at our Tryon estates. Not all types of urinary incontinence are treated the same way, so ask questions. What can therapy do for you? A comprehensive evaluation of your symptoms and needs are the first step. Treatment to strengthen and regain control of your pelvic floor muscles. This may include strengthening, stretching exercises, biofeedback, and/or electrical stimulation, as well as lifestyle changes that we can help you with. Personalized home exercise prescription that meets your specific needs. What else can therapy do? We can work with you for specific bladder training and urge inhibition training techniques for increased frequency and overactive bladders. Activities of daily living training to assist with environmental modification, clothing modification, functional activities, and cognitive re-education and compensation can all help with your continence issues. Therapy and residence partnership. When compliance by resident is combined with skilled rehab program, outcomes are very encouraging. Most insurances cover pelvic rehab. Your therapy department will verify your insurance and inform you of your specific coverage. Your privacy and dignity is important to all of us. All the information is kept extremely confidential. Evaluations and treatment programs are performed in private locations. So Pelvic Health Rehab is here, and we are so excited to be able to offer this to you right here at Tryon Estates. So we are here to help you learn more about your continence issues, to partner with you in addressing your concerns, to work on strategies to improve continence, to answer any and all of your questions, and to work with you on improving your quality of life, to get better sleep and be engaged in things that you enjoy. So this is our October Wellness Talk topic, and we will be continuing to work with you on falls and attention. Your November presentation will be Thriving with Good Energy, how to have more energy and get more enjoyment out of life. And that will be our final session for 2020, and we will keep you informed as to the date of the November presentation. So keep tuned to the bulletin boards and we will let you know. So once again, thank you for joining us today. Aim for dry, and don't forget you can contact us at 894-6680 should you have any questions or want to schedule evaluations for your continence issues.